Gentlemen, if you feel like you're gradually losing your strength, both physically and mentally, please don't rush to blame your age. Many of my patients come into my clinic and say, "Doctor, I eat normally, but lately I just don't feel like myself anymore. My eyes are tired, my sleep is shallow, I feel sluggish, and intimacy? I barely feel anything." They assume it's just aging. But the truth is, it's not. The real reason is this: testosterone, the hormone that defines male vitality, strength, and desire, is quietly slipping away, day by day. And even more concerning, it's not your age that's to blame. It's 5 very common health conditions, ones you may already have without even knowing it. I am Dr. Lucas Neumann, an endocrinology and geriatrics specialist currently working at Johns Hopkins University Hospital, USA. And today, I'll help you understand which silent, widespread diseases are draining your testosterone after 60, and, more importantly, how you can take back control before it's too late. Let's begin. Did you know, after the age of 60, a man's testosterone levels can drop by up to 50% compared to when he was 30. And this decline happens quietly, but its effects are loud and clear. First comes the persistent fatigue, the lack of energy for things you once enjoyed. Then, poor sleep, waking up at night and rising in the morning still feeling tired, drained. Next, a loss of desire, creeping anxiety or low mood, sometimes even mistaken for late-life depression. But perhaps the most dangerous part: most men have no idea their testosterone has dropped until the signs become too obvious. Muscle loss, belly fat accumulation, sagging skin, blurred vision, and a mind that just won't focus anymore. This isn't just aging. It's the result of real, ongoing health conditions that have been silently building up inside the body and ignored for too long. Type 2 diabetes. One of the most common yet silent conditions affecting men over 60. But few realize it's also one of the biggest culprits behind low testosterone. At its core, type 2 diabetes happens when the body becomes resistant to insulin, the hormone that regulates blood sugar. As a result, blood sugar levels stay high, slowly damaging blood vessels, nerves, and, crucially, the hormonal system. In men, insulin resistance leads to disruption of the hormonal axis between the brain, pituitary gland, and testes, ultimately causing a sharp drop in testosterone levels. The typical signs include constant thirst, frequent urination, especially at night, persistent fatigue, slow healing wounds, and, notably, low libido, erectile issues, and a lack of vitality. Many men mistake these as normal aging. But in reality, there are early warning signs of testosterone decline triggered by diabetes. Don't wait until your blood sugar is dangerously high to take action, because by then, your testosterone may have already plummeted. Hypertension and cardiovascular disease. When we talk about testosterone, most people think of the testes, but in reality, the heart and blood vessels play a crucial role in how testosterone is produced and transported throughout the body. In men over 60, high blood pressure, high cholesterol, and arterial stiffness are extremely common. These conditions damage the blood vessels and narrow the flow, making it harder for testosterone to reach key target areas, especially the brain regions that regulate hormone release. And that's not all. Poor cardiovascular health also reduces blood flow to the testes, the very place where testosterone is produced, causing a drop in hormone levels at the source. One commonly overlooked factor is heart medications. Some drugs, such as diuretics or beta blockers, if used long-term without close monitoring, can negatively impact sexual function lower libido, or even cause erectile issues. That's why, if you're being treated for blood pressure or heart disease, don't hesitate to ask your doctor how it may be affecting your testosterone levels and whether any adjustments can be made to better support your age and vitality. Fatty liver and liver damage. Did you know that liver damage can have a huge impact on testosterone because the liver is the organ that converts testosterone into its active form in the blood? A healthy liver ensures that testosterone is properly activated, allowing it to support muscles, bones, the nervous system, and male sexual function. However, if you have fatty liver, hepatitis, or consistently elevated liver enzymes, then even if testosterone is being produced, it may not function effectively. Simply put, a weak liver means weak testosterone. Additionally, the liver is responsible for removing excess hormones and toxins from the body. When liver function declines, estrogen, the female hormone, can build up, disrupting hormonal balance in men and leading to symptoms such as soft belly fat, low libido, fatigue after meals, digestive issues. The good news? The liver has an incredible ability to heal. If you catch the warning signs early and make lifestyle changes, especially around diet, sleep, and alcohol consumption. Abdominal obesity, long-term overweight. For most men over 60, there's one undeniable reality. The waistline expands, while muscle mass shrinks. But the real danger isn't just the appearance, it's what's happening inside. Visceral belly fat isn't just stored energy, it's actually a factory that produces estrogen, the female hormone. As belly fat accumulates, a portion of testosterone gets converted into estrogen through an enzyme called aromatase, which is abundant in fat tissue. The result? Even if the body is producing testosterone, the actual levels of usable male hormone in the blood decline. And men begin to experience unexpected symptoms: slight breast enlargement, soft fat around the waist, increased emotional sensitivity, low libido, and poor concentration. The good news? Losing just 5 to 7% of body weight can lead to a noticeable increase in testosterone levels. So remember, every healthy meal and every walk you take is a step toward reclaiming your masculinity. Sleep apnea. Many men are unaware that testosterone is produced most intensely during deep sleep, particularly at night. But if you suffer from sleep apnea, a condition that's very common in older adults, this hormone production process can be severely disrupted. During sleep, the throat muscles may temporarily collapse, causing brief pauses in breathing, sometimes lasting several seconds, and this can happen dozens or even hundreds of times per night. Every time it happens, blood oxygen drops, the brain is briefly awakened, and the body enters a silent stress state. The result? Shallow, fragmented sleep and disrupted hormone cycles. Testosterone isn't replenished. You wake up exhausted, even after 7 to 8 hours in bed. Common warning signs include loud or irregular snoring, gasping or choking during sleep, morning headaches, dry mouth, irritability, poor focus during the day. If you suspect you might have sleep-disordered breathing, consider doing a sleep study, because testosterone can only recover when your sleep is truly restored. The good news is, you don't need medication to start improving your testosterone after 60. Small lifestyle changes, when done consistently, can lead to real improvements within just a few weeks. Here are 4 simple principles I always recommend to my patients. 1. Prioritize quality sleep. Since testosterone is primarily produced at night, go to bed before 11 p.m., avoid screens before sleep, and aim for at least 7 hours per night. 2. Move your body daily. Brisk walking, cycling, or light resistance exercises can naturally stimulate testosterone production, while also burning fat, especially belly fat. 3. Eat smart. Choose a Mediterranean-style diet, rich in greens, fatty fish, olive oil, and nuts, and limit refined sugars and alcohol. This eating pattern is clinically proven to support long-term hormonal health in men. 4. Get regular health checkups, especially for common conditions like diabetes, fatty liver, high blood pressure, and sleep disorders. Early control is key to preventing hormonal decline. Remember, testosterone doesn't disappear in a day, but it won't return unless you take action. Start with one small change today, and your body will thank you tomorrow. Aging is inevitable, but the decline in vitality, masculinity, and testosterone, that can absolutely be changed. What matters most isn't how old you are, but whether you're willing to take action today. With just a few adjustments in your sleep, diet, movement, and by managing common health conditions, your body can begin to reclaim its natural hormonal rhythm. I truly hope today's video has inspired you to step into this next chapter of life with strength, control, and renewed energy. If you found this content helpful, please share it with a friend or loved one, and subscribe to this channel for more accurate, science-backed health advice directly from a medical perspective. My name is Dr. Lucas Neumann, and I look forward to seeing you in the next video.